everyone, I'm going to demo how to do a dry sterile dressing change along with applying sterile gloves and taking them off. So you want to make sure you have all of your supplies before you start your skill. Remember, you have 10 minutes. You have to take in your timer, set it to 10 minutes. You need to review the video, review the checklist, and you have to have hands-on practice before you can test off. When you're ready to test off, you're going to make sure you have all of your supplies. You want your sterile dressing tray kit. You want your sterile saline or your saline. You have your clean gloves, your sterile gloves, and then you need what you're going to clean your wound with. You also have a tape measure, your Q-tip that you want to measure your wound with, and a pen to mark all of your tape. So before you begin, you have your supplies. You're going to go ahead and clean your hands. Once you're in the patient's room, introduce yourself and let them know what you're doing. You want to check your order. For this order, we're doing a wet to dry dressing change. So I already cleaned my hands. I'm going to go ahead and open my sterile kit and just remove the red bag that is on top. You're not touching anything else so you don't break that sterile field. Then I'm going to put that off to the side. This is going to be your trash bag. If you have a trash can close by and you don't need this, then you just remove it and put it to the side. I'm going to open mine and pouch it and put it right by the bedside so that I can throw everything away. If you have hair falling down or a name tag, you want to make sure your hair is up or things are out of your way so nothing is falling into and breaking your sterile field. Now I'm ready to remove my old dressing. So I'm going to take my clean gloves. This is not sterile. Apply clean gloves to remove that dressing. When you take it off, you are going to see what the dressing looked like. Does it have any drainage on the dressing itself? What color is it? How much? And does it have an odor? When you take that off, you're going to gently peel that tape back, making sure you don't rip or irritate their skin. This is a mannequin, so obviously there's no drainage on it, but you'll want to note color, how much, and if it has any odor. You're going to gently remove this inside packing. If it's sticking to the patient's skin, then you can take some of your saline and pour it on there just to loosen that up so you don't irritate them too much. So you're going to remove that. When you have your dressing, if your bag is not there, you're going to take your dressing, you're going to ball it up in your hands, and then you remove this pair of clean gloves and throw those away. I'm going to wash my hands again. Then we're going to look at our actual wound bed. Is there any granulation tissues, any slough, any eschar? What did the edges and the surrounding tissue look like? And you need to remember that for your documentation afterwards. Whatever wound you have during your checkoff, that is what you're going to document on. So I washed my hands. Now I'm going to irrigate my wound. So I'm going to put on another pair of clean gloves to irrigate. I'm going to have my normal saline, and then I'll have my gauze. So after you get your clean gloves on, you grab your normal saline. I have my gauze to clean it with, and then I'm going to make sure my tape measure, my pen, and my Q-tip are close by for measuring. So you're going to open your saline. You make sure if it's a new bottle that you date it. If it's not a new bottle, then you make sure that it's not expired, and then you lip off your saline. You're going to place your lid cap up so that you can place it back on there. You're going to take out your gauze. This I also only like to touch by the corners so that whatever you're cleaning with is not touched by you. So you can either take a syringe with saline, or you can pour it on there, or you can dip in your gauze. I'm going to pour it directly on the wound to irrigate. So I'm cleaning that area. I'm going to take one of my gauze, clean the inside, and you want to use a new piece of gauze for everywhere that you wipe. So clean the inside of this out, and then I'm going to pat around the edges. One side down, and then the other side down. So once that's nice and dry, I'm going to move my saline to the side. This is done. Now I'm going to measure my wound. Sometimes you'll have a measuring tape on the side of your gauze packet. If you didn't bring in a measuring stick, that can be helpful. But we brought in our measuring tape. Remember, length is head to toe, width is side to side, and then depth is in the center. If you have any tunneling or undermining, you're going to use the face of the clock. So let's say my tunneling is at 2 o'clock. I'm going to take my Q-tip, press it in there, put my fingers at the opening, and then lay it up against my tape measure. This particular one does not have any tunneling. So we're just going to measure it top to bottom from the opening, from the widest part, top to bottom. I'm going to note where that was. You can mark it with your pen. Then side to side, and you want to get it to the centimeter. And then you're going to do your depth. So I'm going to open my Q-tip. I'm going to put this Q-tip all the way to the bottom of my wound. My finger is going to be at the top edge. So then you pull that out, lay it along your tape measure, and get your depth measurement. Once you're done with that, you're going to discard those gloves, and then you're going to set up your sterile field to put on your dry sterile dressing. I got tape ready beforehand, so you're going to put pieces of tape down here, and I also took one with my initials and the date. This is a once a day dry sterile dressing change. I'm going to open up my sterile kit and take out my sterile field. Now remember, you want to hold this by the edges and the corners so that the middle of this field stays nice and sterile. Anything it's touched, so the edges, you don't want to put any of your sterile things at the edges. Put it all in the center. Move things out of the way if you need to. All right, then I'm going to take my sterile contents and dump it out in the middle. This way, I have my container here. I can take my saline and pour it in here before I have my sterile gloves on, so I don't contaminate my hands. Now I'm ready to get my sterile gloves on. So you get your sterile gloves, open them up. Remember, you're using the corners so that you don't contaminate. So you open them up from the corners. You're going to take the opposite glove, or your opposite hand, pinch it from the outside. You don't want to touch any of the inside of the glove. So pinch that, and you're going to slide that first hand in without touching this outside part so it stays sterile. That other hand, you're going to scoop it under that cuff on the opposite glove. Put that hand inside without this sterile hand touching the inside. So now you have your sterile gloves and your sterile field. So I'm going to go ahead and set up. I've got my gauze for my wet to dry. I'm going to place that in here, making sure it doesn't touch anything that isn't sterile. I already have my tape ready, so we'll put that off to the side if we need it. My scissors if we need it, and then the safety pin, but we don't need that for this particular dressing. I'm going to take my simulated swab sticks. You can actually use these on your mannequins because it's just saline for teaching purposes. So you're going to open this up, take your swab stick. You have 3 in here, so you're going to clean your wound from top to bottom or bottom to top just one time. You will not go like this and move infection around. Once you swipe, that's tossed. So I did through the center, and then I'm going to do around the outside edge and up, toss, and then the opposite side, up and toss. This is done. Remember, don't touch anything with your sterile gloves to break that field. Now I'm going to get my gauze. So it's soaked up a lot of this saline. You don't want it too moist. So you're going to pick it up for your wet to dry. You're going to take it and wring it out. So once you have that wrung out, you're going to take it and you're going to fluff it up a little bit. It's helpful too, especially if you have undermining or tunneling, to take the tweezers to help you fluff it up and then to pack it inside of that wound. You don't want any of this wet gauze on that good tissue. You just want it on the wound itself. And you don't want it too tightly packed in there. So if you have too much gauze, you're not going to use all of it. So for this wound, you're going to start at one end, pack it in there. Make sure that damp gauze is touching all of that wound surface. Once you get it nice and fitted to your wound, you can get rid of those tweezers. Then I'm going to take my ABD. So this is a little big for this wound. If you had the full body of the patient, you could probably use this and tape it. Since we have such a small little simulated piece, I'm going to fold this in half and place it over my wound. Then I'm gonna take my tape and I'm gonna secure this to my patient. And now I've obviously broken my sterile field, but the sterile part of this procedure is done. Tape your other side and make sure you're using the type of tape that's right for the patient. That's why you wanna see when you take that dressing off, what did they use? Because a lot of times it's the patient's preference if they want paper or surgical tape. And then I also have to include my tape that has my initials and my date. All right, so my patient is taken care of. I'm gonna clean up my field, take all of your supplies, throw them away, discard your dressing kit. With your gloves, you're gonna pinch the inside of one glove and pull it off, so all of that dirty is away from you. Then you ball up that other glove, take your fingers underneath, pull that glove off away from you, ball it up, and then you toss it so you don't touch anything that might have been potentially infected. Then you're gonna go ahead and wash your hands, finish cleaning up your field. Check on your patient, ask them if they're okay, do you need anything? Here's your call light, open your curtain. You're gonna throw your dressing stuff away and you're gonna wash your hands again before you're done. So that is it for dry sterile dressing and sterile gloves.